Patients usually come to us complaining about headaches when they wake up or when they feel like they're having a lot of tension around their ears and their jaw. And that usually ends up starting with a conversation. And then that's how we'll be able to discover some options as a treatment, sometimes involving Botox, that can relieve some of those issues for them. Botox is a very powerful and sometimes the best options for patients dealing with TMD issues and headaches related to muscular pain. When night guards or medication is not really appropriate, sometimes they're not able to wear or physically wear a night guard at night, or certain medications are contraindications. So sometimes the Botox is a great option to be able to alleviate that issue for them. So one of the things that people surprise the most about Botox treatment for their issues with TMD and headaches, how fast the relief comes. It's sometimes within the day or several days later that they feel massive relief in the pressure and the pain. And so that really allows us to be able to offer this option as a very quick alternative to a lot of the pain that patients are suffering from TMD and headaches. We do a very detailed functional exam so that we can differentiate their pain, so that we can make sure that that pain is coming from muscular joints, teeth, headaches, or maybe a combination of all three of those issues. So we do a very detailed exam so that we can make sure that we're offering the correct options to alleviate the issue. A lot of times when we're looking at a patient and we're seeing things like recession, patients complaining about sensitivity, we see teeth chipping, we actually see fracture lines. That also leads us into another conversation about what else is going on beyond the actual teeth. And sometimes we're able to discover that there is a lot of muscular issues, headaches, and other things that we can discuss even further. And that allows us to be able to offer options like Botox to treat that muscular issue. So once we do a treatment that regards to TMD or headaches, I tell patients it's like therapy. Sometimes that therapy does need to be maintained, and sometimes it's transient, meaning that that might be a life issue that's happening that's really big that they need to be treated just for that in that short amount of time. And sometimes it's a lifelong stressor that does need to be maintained periodically. And like with any therapy, in order for it to be consistent and to give you long-term relief, that needs to be continued for a period of time, or maybe for an extended period of time. When you're doing Botox in a dental setting instead of a med spa setting, think about we're here as dental professionals. We are specializing in head and neck anatomy for the better part of our dental school education. So it's really important to understand that we are the experts when it comes to anything from the neck up. So when I'm looking to explain to a patient why choose getting your dental Botox or any type of Botox treatment related to whether it be cosmetic or therapeutic, I feel like we are the type of practitioner that is specializing in that region of the body. So all the more reason to be able to go to a provider that not only is educated longer in that area of the face and head and neck, but also be able to provide follow-up visits and be able to check you overall besides just the Botox area. When patients are suffering from TMD issues, headaches related to muscular issues, and they're getting relief, it is a game changer for those patients. They're able to sleep, they're able to focus, they're able to function, they're able to enjoy time with friends and family. It's an immediate and almost like almost like someone took off the pressure off those joints. So it's incredible. A lot of our patients find that they're able to loosen out that knot so quickly and so effectively that it's really hard to imagine that they didn't do it sooner.